Heart disease and anxiety are both prevalent conditions that can significantly impact a man's health, but they manifest with symptoms that can sometimes be challenging to differentiate. While a heart attack often presents with chest pain, tightness, and potentially radiates to the left arm or jaw, it can also share symptoms with anxiety such as shortness of breath, heart palpitations, and a feeling of impending doom. Conversely, anxiety typically involves persistent worry or fear that can lead to physical symptoms like trembling, dizziness, and excessive sweating, often without a clear or immediate cause. Treatment for heart disease may involve medications, lifestyle changes, or surgical interventions, whereas anxiety is often managed through therapy, lifestyle modifications, and sometimes medication. Risk factors for heart disease include smoking, high blood pressure, and high cholesterol, whereas anxiety can be triggered by stress, genetics, or underlying health issues. Here's a more in-depth look at these two distinct conditions and their detailed aspects. Presentation: onset, sudden versus gradual. Heart attack symptoms in men often manifest suddenly and with intensity, such as chest pain or pressure, pain in arms, neck, jaw, or back, and shortness of breath. Anxiety, however, typically has a more gradual onset, with progressive feelings of nervousness, chest discomfort, palpitations, and breathlessness that can spike in stressful situations. While anxiety can mimic a heart attack, the sharp, crushing pain and the sense of doom accompanying a heart attack are generally more abrupt and can escalate quickly, necessitating immediate medical intervention. Distinguishing between the two conditions is crucial as they require different treatment approaches. A heart attack is a medical emergency, whereas anxiety is managed with long-term psychological support and, if needed, medication. Chest manifestations: pressure-like pain versus sharp tingling. Heart attacks in men often present as a pressure-like pain in the chest that can be mistaken for indigestion. However, it's typically accompanied by other symptoms, such as shortness of breath, nausea, and a cold sweat. This pain is persistent and may radiate to the jaw, neck, or arm. Conversely, anxiety can provoke sharp or tingling sensations in the chest, evoking fears of a heart attack. This pain is often more localized and may be accompanied by hyperventilation, a racing heartbeat, and a sense of panic. Understanding these nuances is crucial, as misinterpreting anxiety for a heart attack could lead to unnecessary medical interventions, while dismissing heart attack symptoms could be fatal. It is essential for individuals experiencing any of these symptoms to seek immediate medical evaluation to determine the cause. Associated symptoms: physical exhaustion versus mental disturbance. When differentiating between the symptoms of a heart attack and those of anxiety in men, it is crucial to note that while both conditions can lead to chest discomfort and palpitations, the context and associated manifestations often provide key distinctions. A heart attack typically entails sudden physical exhaustion and may be accompanied by pain radiating to the neck, jaw, or arm, shortness of breath, and cold sweats. Conversely, anxiety tends to have a more pronounced mental disturbance component, with symptoms such as feelings of dread, restlessness, and disproportionate worry. Panic attacks can mimic heart attacks, but the absence of the aforementioned specific cardiac symptoms and the presence of hyperventilation, alongside a sense of impending doom or fear of losing control, lean the scale toward anxiety. Recognizing these nuances supports timely and accurate medical evaluation and intervention. Trigger factors: physical exertion versus emotional stress. Both men's heart attack symptoms and anxiety can manifest with chest pain and palpitations, making it challenging to differentiate between the two. However, the triggers are often telltale. Heart attack symptoms in men typically arise from physical exertion. When the heart muscle requires more oxygen during increased activity, but blocked arteries impede the flow, pain ensues. Conversely, anxiety often has emotional stress as its trigger. Panic attacks can appear out of nowhere or in response to a stressor, causing rapid heartbeat and chest discomfort. Recognizing these trigger factors is crucial for timely and appropriate treatment, as misinterpretation can lead to critical delays in addressing a potentially life-threatening heart attack or the unnecessary escalation of anxiety treatment protocols. Response to interventions: relief by medical therapy versus relief by psychological therapy. When differentiating between men's heart attack symptoms and anxiety, the response to interventions is a pivotal aspect. Heart attacks in men often present with chest pain, shortness of breath, and other systemic signs that usually respond to medical therapy such as nitroglycerin or aspirin, tailored to alleviate cardiovascular distress. On the other hand, anxiety might mimic these symptoms but typically shows significant improvement with psychological therapy, including cognitive behavioral strategies, relaxation techniques, or anxiolytic medication. While a heart attack demands urgent medical intervention, symptoms of anxiety, once identified, are often managed with longer-term mental health support, emphasizing the importance of accurate diagnosis to guide effective treatment.